Each week on the Viewpoints Radio podcast, you'll hear from our leading experts on an important topic within education, history, society, psychology, and more.
If you can show a good money personality, one where you've got good values around how you acquire, how you use, and how you manage money, those patterns will be passed along generations.
Viewpoints Radio podcast is produced by our team of award-winning journalists. Subscribe today by searching Viewpoints Radio wherever you listen to podcasts.
Usually, when talking about tumors, the conversation quickly turns into questions of what type of cancer it is and how much chemotherapy is needed. However, there's one type of tumor that a majority of women will develop in their lifetime, but many will have no idea. Fibroids are made up of muscle cells and fibrous tissue and are almost always benign. They tend to grow inside a woman's uterus, but can also appear on the outer surface of the organ. And while the exact cause of fibroids is unknown, Dr. Nicole Williams says there are some popular theories based on our current data, particularly for why Black women are more likely to develop them.
There seems to be a genetic predisposition to fibroids because I've actually been to West Africa where the predominance of African Americans' ancestry lies. They grow massive fibroids in certain populations. So there's that genetic predisposition.
Williams is a gynecologist, pelvic surgeon, and founder of the Gynecology Institute of Chicago. She says that even without a genetic predisposition, many women of all ethnicities are still vulnerable.
It's almost like you need to have a perfect storm. So if you have zero family history of fibroids, you're unlikely to start growing them as early as you would. So you might be one of that 70% of women who just happens to grow a fibroid because she has a uterus and it's been around for a while. Those are usually the asymptomatic kind.
Nearly half of all fibroids don't cause any symptoms at all, hence why many women never realize they're there in the first place. Even Williams was surprised to find out that she had developed a small fibroid.
I hurt my back trying to move a table with my husband, and I ended up getting an MRI, and they said, oh, you had a fibroid. But as an African-American woman of a certain age, it makes sense because 80% of African-American women are going to have a fibroid by the time they're 50. I'm under 50. And 70% of all women are going to have a fibroid by the time they're 50. And like we said, only about 40% of fibroids are completely asymptomatic. So you can live your life and not even know you had one, just like me. I just happened to say, oh, okay, sure. But I can at least empathize with my patients because I know I do have one of these and it could affect my life in the long term.
However, since her fibroid isn't causing any trouble, Williams is opting to monitor it year by year instead of having it removed. There's no hard data that points to why some tumors cause symptoms while others are practically invisible, but current research supports the idea that hormones play a big role.
Each week on the Viewpoints Radio podcast, you'll hear from our leading experts on an important topic within education, history, society, psychology, and more.
When you have lawmakers that create systematic policies that are really only set up to favor people with deep pockets, then you have the rise of corporate industry taking over.
Viewpoints Radio podcast is produced by our team of award-winning journalists. Subscribe today by searching Viewpoints Radio wherever you listen to podcasts.
Williams says that long-term estrogen exposure has been linked to symptomatic fibroids. So factors like going through puberty early might increase a woman's risk.
So if a girl starts having her period at 8, she's more exposed to estrogen over a longer period of time, which could result in fibroid growth.
Having high levels of estrogen is another factor that can increase exposure and therefore raise the risk of developing fibroids. These elevated levels can be due to many different things, including medication, stress, or being overweight.
So if you're obese, you actually have elevated levels of estrogen. And we do know that is one of the risk factors for developing fibroids, but you also need to probably have that genetic predisposition. So if you're overweight, you started your period very early, that's going to give you a longer exposure to estrogen and progesterone, which we do know that fibroids are responsive to these hormones.
Still, that doesn't mean that all women who are overweight will get fibroids or that the healthiest won't. At the end of the day, all women are at risk.
If you have a uterus, you are probably going to be part of that 70% of women who's going to develop a fibroid. Now, is that fibroid going to kill you? Is it going to affect your life in any way, shape, form, or fashion? No, just like my fibroid. Like I said, I didn't even know it was there. I just happen to be part of that contingency of women who tends to grow fibroids. And like we said, they're excessively common.
But you can't leave them alone. Just like any other tumor, fibroids can grow and change over time.
They seem to start slightly earlier than what we thought because they start very small and then they can grow very large. These tumors can range anywhere between the size of a raisin to the size of a watermelon. It's important to raise awareness for fibroids because even though many fibroids are not symptomatic, most fibroids are symptomatic and they can be hellishly symptomatic because patients can get symptoms where they have life-threatening anemia, where they can't even climb a flight of stairs without being winded. So that's going to affect your heart health.
According to the CDC, heart disease continues to be the leading cause of death for women in America. Having a fibroid that causes heavy menstrual bleeding only raises this risk. In addition to longer periods and heavy bleeding, the tumors can also cause cramping, chronic pain, and constipation.
I mean, they can cause bulk symptoms too. So even if you're not bleeding or having any pain, they can cause bulky symptoms. I have patients not even be able to button up their pants because the tumors get so large.
Another severe symptom is infertility. This can happen in a couple different ways, one being that the tumor interferes with implantation. Since it's growing inside the uterus, there's nowhere for the fertilized egg to safely attach itself.
Secondarily, if the fibroids are large, when you release your egg and it's supposed to be taken up by the fallopian tube, if the uterus is really large, then the tube can't find the ovary, and then your egg never travels into the uterus to be fertilized in the first place.
Aside from the direct symptoms, a recent trend of fibroid research has been to look at the impact they have on a woman's quality of life. And in a new review published in the journal Fertility and Sterility, researchers found that these tumors can cause negative effects on mental health.
We have plenty of data that says that women who are in chronic pain are more likely to suffer from anxiety and depression than those women who are not in chronic pain. So if you have fibroids and they're causing you pain, discomfort, and you can't leave your home, you can't lead a vital life, or if you're even just too tired because you're bleeding too much, all of these factors are going to go into shaping your mental health. And if you're suffering with fibroids, of course, you're more at risk for both of those conditions, anxiety and depression.
So being able to catch symptomatic fibroids early will help give these women their lives back. Williams says that, depending on the size, it could be discovered during an annual wellness checkup as the doctor feels around the pelvic area. But small fibroids are often only found using an ultrasound. If the tumor is causing these negative symptoms, there are various surgical procedures that are used to cut the fibroids out, but there's also good evidence for alternative options.
There seems to be some type of correlation, which they're actively still studying right now, that shows that if you have a low vitamin D level, there's something about having low vitamin D that allows fibroid tissue to proliferate.
In other words, being deficient in vitamin D can make the fibroid grow. The same correlation is being found with green tea as well. So some of the alternative options patients seek out include supplementing with high doses of vitamin D and green tea extract. There are also medications that can help, such as GnRH antagonists, which are a class of hormonal drugs.
What these do is actually kind of dial down your hormone level, because we talked about having these excessive levels of hormone in the system, which feeds fibroids. So medications like a Myfembree, these are medications that will actually decrease your overall hormone level, which should help decrease, and it does, we have clinical data, which actually decreases the amount of heavy bleeding and can actually reduce the size of the fibroid to a very, very tiny extent.
You can find more information about Dr. Nicole Williams and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
Each week on the Viewpoints Radio podcast, you'll hear from our leading experts on an important topic within education, history, society, psychology, and more.
building AI systems is like having kids. You want your kids to be smarter than you are. You want your kids to be more successful than you are. And at the end of the day, you want your kids not to kill you.
Viewpoints Radio Podcast is produced by our team of award-winning journalists. Subscribe today by searching Viewpoints Radio wherever you listen to podcasts.